diagnosis of cancer, the word cancer is petrifying. When the diagnosis comes down, it is so difficult to process. You need to find someone that you can trust to take care of you. I've taken care of thousands of patients with cancer, gynecologic cancer, and not only that, my dad, my mother-in-law, both faced cancer, both died unfortunately. It is a difficult transition, but the outcomes are getting much better these days. We have far better surgery, we have far better therapies. I'm an integrative gynecologic oncologist. In fact, I'm the only one in the country that's quadruple board certified in gynecologic oncology, women's health in general, and in holistic and integrative medicine by 2 separate boards. What does that mean for you? It means that I have done a lot of extra special training in order to understand and embrace Eastern thought into Western practice. So sometimes we just don't have solutions in the Western side of things to help people get through cancer. That's not to say the vitamins or diet are going to cure your cancer, but a very precise look at your lifestyle, toxin avoidance, exercise, lifestyle changes, nutrition, targeted supplements, in particular after treatment, can improve survivorship. We know that the data is building. It's very exciting. And not only is it just a clinical observation, we have molecular evidence for this. The things we offer include mind-body approaches, mindful movement, something called heart math, which is a biofeedback method, exercise approaches which help you get through the journey, nutritional counseling, not just for how to maintain your body weight, but how to fight cancer also, how to supercharge your body, how to cancer-proof your body as much as possible, boosting your immune system to the extent that it's possible using nutrition and lifestyle modification, including toxin avoidance and things of this nature. We used to use large incisions, literally from the chest down to the pelvis, in order to do large cancer surgeries. But now robotic surgery has changed all that. We're able to access all of these areas through small incisions, using 3D cameras, so the visualization is even much better than if you're looking inside with your own eyes. It's magnified. And the instruments are what's called reticulated, which means that at the wrist they can move just like little hands on the inside, holding scissors and so forth. So it is a very precise and elegant way to do major cancer surgeries. We have a nurse navigator and a physician's assistant to help shepherd you through the entire process. Sometimes it's very difficult to stay on top of what appointment is next. Where do I go? What do I do? What labs I need? These are all very detailed but very important parts of your therapeutic process. And we help you with a team-based approach. There's something called the science of connection. I think if you don't connect with your doctor, and if you don't trust your doctor, there has to be a two-way trust. You should have several options on the table at all times. At all times, there are options, whether they be research or standard approaches or complementary support. I dare to say alternative approaches, some of which are helpful and are in research. Others are complete bunk. You need to be able to trust your doctor to guide you through what you need to do. You don't really have time to do all of the research using Professor Google or well-meaning friends who may have known somebody that took something in the past and perhaps they got help by that, but most of the time it just flat out doesn't work. You need to be guided to the best possible options in both mainstream and in complementary natural integrative support, and that is what I do. I work at St. John's Hospital, which is in Santa Monica, California, and across the street is the John Wayne Cancer Institute, where there is a whole lot of basic science and translational research going on, which we participate in as a department. This translates into clinical trials as well. where we're able to export those things that are found in the lab and essentially provide them to you in the clinical setting. It's very, very exciting these days because we're able to determine on a genomic level what the cancer may respond to and have very, very targeted therapies. We also have better and better approaches for diagnosing cancer early, and that is prevention is certainly the best thing you could do, but diagnosing something early is the next best thing you could do to improve your chances of beating the cancer. If I were to give advice to someone seeking gynecologic cancer care, I would say seek someone that you can connect with, seek someone that can give you options. In other words, if you hear one option only, one approach only, maybe large incision only as opposed to robotics as well, you probably should get a second opinion to see if perhaps there are other ways to approach the cancer treatment for your particular cancer.